Good afternoon, everybody. Hopefully, everybody is doing well. Dear healthcare providers, today we just want to explain about the axial resolution. What is axial resolution, and why do we need to know about the axial resolution? What are the importance about the axial resolution? Which transducers have good axial resolutions, and which transducers, yeah, probes are having bad, or we can say degraded axial resolution. So this way, if we know axial resolution, what it is, then it will make it easy for us to use the correct probe for the correct application and on the correct area. So let's talk about the axial resolution. Actually, first of all, resolution, what is resolution? Resolution is when we talk about to image correctly, to image accurately, to image more diagnostically, perfectly, the image which is really matched to the real anatomy of the human body or animal body when we're scanning. So we have different resolutions. Today, I really wanted to explain or talk about the axial resolution. What is axial resolution, and where do we need it? If we are using a wrong axial resolution, what can be the side effect of it? What can be the artifacts which can produce by the not correct resolution we're using, specifically if we're using the axial resolution? So be with me. Let me try my best to explain it. What is axial resolution? Like as I said, resolution is to image correctly, to image accurately, and then it will be more diagnostic. Actually, we're trying to have that image. Now, for the axial resolution, when we send our sound pulses to the human or animal body, it just produce a virtual beam. It just enter after the skin. It just enter to the body, and then they made a beam and an ultrasound beam. And then if any structures which are parallel to the main axis beam, or we can say if uh, we have two structures which are back in front with their self, like if the relationship of the structures when they are back in front, like my left hand, this fist, and my right fist, they are back in front of each other, but also for my vision, or I can say for the light of my eyes, the main beam, they are parallel, they all go on the same direction. Let me show you guys with sharing the whiteboard. Maybe that make it easier a little bit. Let me share my whiteboard with you guys. And let's see here. For example, when we are scanning something, I can say, for example, if this is a probe, if you're scanning from here and pretend this is a probe, you're just using a probe from here. Now we all know that we will have a beam, the beam which is made by this transducer, it will conversion and it will diversion after that. So it will be like a virtual beam, we can say, or it is something, it's just, we don't see this beam, but we think the beam is like this. And now all the pulses will come straight on this way. So this is the main axis beam, with the red color you see. Now, if there are structures, now if there are, for example, pretended if there are two structures, for example, one structure is here, one structure is here, and pretend maybe like three, this is another structure. Now three of these structures, they are parallel to the main axis beam. It means the sound pulses are going down from here, correct? All the pulses are just moving this way, all the pulses are going down, and these are the structures. The structures are front and back to each other, but they are on the same lane, on parallel to the main axis beam. So the relationship of the sound beam with the structure, that is parallel, but the relationship of the structure to each other, they are front and back to each other. Or easy example will be, for example, if we have a thyroid tissue, pretend it, if we have a thyroid tissue, just pretend if this is a thyroid tissue for us. Now, if we have, for example, nodules, like three nodules, pretended one nodule is here, one nodule is here, one nodule is here. So these three nodules are One is kind of superficial, another was a little bit, in the middle area, a little bit deeper than the first one, and the third one is more deeper. So they are inside. For example, this is a structure. Now, one nodule is here, one is behind that, but in the middle area, and the one is on the bottom. So you're scanning from this portion, from the top portion. Now, the beam go inside of this. So three of them are parallel to the main axis beam, but with their self, they are behind of each other. We can say front and back. For example, this structure number one, this or we can say nodule number one, nodule number two, and nodule number three. So the nodule number one pretended, it's kind of a little bit superficial. It's a little bit shallower compared to the nodule number two. And now nodule number three is the deepest one. So pretend that the sound pulses are coming from this portion. And first they will hit structure number one or nodule number one. And then after that, they will hit nodule number two. And then the last, they will hit nodule number three or structure number three. So that's what it means. They are parallel to the same, they are parallel to the main axis beam. That's one thing. And secondly, between them, they're front and back of each other. Now, why do we need to know axial resolution? And which probe have better axial resolution, which one have bad axial resolution? So this way, we will know which probe to be used. That is important. Now, for example, if I want to look something very serious disease, for example, this is a thyroid tissue. In this thyroid tissue, there are three structures, three masses, three nodules, three tumors. I don't know, but there are three masses. Let's put it mass. So there are three masses. To know very detail of these nodules or these masses, what they are, what is their structure, what is their ecotexture, how they look like, because we want to close to the diagnosis. And also, we want to know the numbers of them. Is it 1, 2, 3, 4, 5, multiple? How many there are? So, axial resolution is very important, not only to know the detail of them, to give us the information regarding these three masses or these three nodules or structures. So not only to know the detail, also will give us the correct number of them too. So axial resolution is important for them. Now, because this is a thyroid tissue, it's a superficial structure, I have to use for that a high frequency transducer. A high frequency transducer will be the best for this. Why? Because if I use a high, pretended, this is a probe which is 10 megahertz. Okay, this is, sorry, 10 megahertz. And there is another probe. Here is another probe. Here is another probe. And pretend this probe is 5 megahertz. Now, I want to know which will be the best probe to use. Now, okay, just from theory, we know better to use the high frequency. But why? What is the reason behind that? I want to know the secret. Why I should use the high frequency? Why not this low frequency transducer, which is 5 megahertz? Instead of 5, why I should use 10 megahertz? What is the secret behind that? Now, the secret is with a 10 megahertz, the higher the frequency, the smaller the pulses are. Pretend it. This is a 3-cycle pulse. Pretend it. It's like a 3-cycle pulse. It's another pulse, which are 3 cycles. It's another 3-cycle pulse. And now, this is a 5 megahertz transducer. Now, when they send pulses, this 5 megahertz, which is lower than the 10 megahertz, they will also have a 3-cycle pulse. For example, one pulse is made of 3 cycles. Now, their cycles are like this. 1 cycle, second, and third. Now, again, next pulse. 1, 2, and 3, and so on. So if we look to this pulse, now the area or the distance of this one pulse, this pulse, this one pulse, it's called SPL, spatial pulse length. So this is also same thing. This is also SPL. Both pulses are made of 3 cycles. What is the difference? The difference is the SPL for this transducer, which is 10 megahertz, it is a lot smaller. It's a short SPL. And the SPL for this one, which is a 5 megahertz transducer, this one, that has a bigger, a longer SPL. Now, the shorter the better. Why the shorter the better? Because if I use this 10 megahertz transducer for these nodules, not only it will tell me about the detail, like how much the size of the nodule or the mass is, where is the mass, and also it will tell me how many are they, like the numbers also. Why? Because look at here. When I use this pulse will specifically give you the information regarding this mass number 1. This pulse number 2 will give you information just about this distance, that there is a distance. Now, this one will give me the information about this mass, and this will give me the information about this. Or maybe I can say there's another pulse, which is a shorter pulse, that will give you information about this distance, which is here. Now, on the screen, when I'm looking on the display on my TV or any screen I'm using to see my pictures, images, for this one, pretend it. If this is my screen, so all these ones will be presented on the picture here for me. They will look exactly, that will match to the anatomy or to that whatever you see in the patient, if it's a human or animal. But the main thing is now you can do your correct measurements if you want to do side to side and anteriorly posterior, or you can know the numbers of them, how many are they. So this low SPL, smaller, shorter SPL will give you exactly the copy, exactly the accurate information what you see in this thyroid tissue. So that will give you the detailed information about these masses, what are they, and plus they will tell you how many they are. So your report and patient's anatomy, whatever is in the thyroid tissue, the masses, it will exactly match. So this is one of the reasons we have to use this high frequency transducer for the superficial structures. That's a different story. Yes, we should use it. Plus, if we want to know a detailed picture, if I want to see something very detailed, I have to use high frequency transducer. I understand. High frequency cannot penetrate better. Then that's the only option. You have to use the low frequency. For example, if you're looking for the pancreas, if you're looking for the kidney, if you're looking for the quadrate lobe of the liver, then your high frequency transducer cannot image correctly from that area because this will attenuate fast. So that is a different story on that case. But if you want to scan superficial structure, the main secret or purpose of the high frequency transducer to use it in these structures, because they will give you the accurate axial resolution. That will give you the high quality axial resolution. Now, the smaller the SPL, spatial pulse length, this length of one pulse, the shorter, the better. That will give you a more detailed picture actually. Now, if I have this pulse, 5 megahertz transducer. Now, if we look at here, let's think about this one. Pretend these 3 structures were here, okay? Or there, doesn't matter. I mean, these 3 structures or 3 masses. If I use this low frequency transducer, the whole pulse will give me one information. These 3 on the screen, on the display where you're scanning, pretend if this is your screen where you see your picture display, you will see all these 3 of them, the masses, they will give you a picture like this. Now, this is a one structure. You see one picture on your display. In reality, it's not one picture. It's a 3 masses. But here on the display, it will tell you there is there is one mass. That's it. It's a tumor, it's a nodule, it's whatever it is. but it will tell you that there is one structure, one unusual structure seen on one of the lobe of the thyroid tissue, because you're using the mistaken probe, because it has low frequency. And why I'm using the wrong probe? Because the SPL on this one, I know both of them are 3 cycles. This is 3 cycles, this is 3 cycles. But the problem is with a low frequency transducer, their SPL, their pulses are longer. Their cycle numbers may be smaller. There's a few cycles, same thing. It's 3 cycle there, 3 cycle here. But the pulse cycle duration is big. The cycle length is big. So the SPL length is big. And that will give me, because this one, this whole pulse, it is responsible for this area from here to here. Now, whatever is here, this all will represent here as a one structure. Now, if I send this information to my surgeon, maybe this patient needs a surgery next. If I send this to the surgeon, so most probably my report is mistaken. Okay, this is correct. I said there is a mass, but it's one mass that is wrong. There are 3 masses. And I just give them one mass with a measurement of, like I have to measure this, for example, I'm going to measure it anteriorly and posteriorly, or we can say superior and inferior and side to side. If I give them this information, this is mistake. It's not correct. So now I'm sure you guys understand what is the difference, where to use which probe. So I'm sure, let's make it briefly, like in one word. If you want to have a detailed picture, not only because of the echo texture, also by the numbers of the masses you're looking for. Maybe it's a serious problem. Patient is in ICU, CCU, maybe emergency room, or maybe the next step is the surgery. Now the surgeon refer the patient to you as a doctor, like, okay, if you could look and give me the information, what is your ultrasound study says or sonography says. So in that case, we have to look to use the correct probe for that. So now, if you really want to know the detailed picture, use the high frequency. And the reason because of the SPL, it has a shorter SPL. It will give you the correct and accurate information. That is called axial resolution. If we use the wrong probe, it will give us artifact. That is when they open and they do surgery. Next step is maybe surgery. When they open the patient, our report, our final or preliminary findings are not matching to the surgery when they open the organ, because it's a mistake. So I hope this will help you guys. And if you have a question or confusion, comments, or any suggestion, you can leave it on the video below. So I will try my best to explain it maybe better than this. So just wait for the next resolution. It will be lateral resolution. And let me try to explain that too. What is lateral resolution and how we calculate information on that one. Okay, thanks a lot. Take care, all of you, and have a nice day. Thanks a lot. Appreciate it.